If we take away hope, we take away any reason to live, to move forward, to get through a difficult time, to get through a difficult treatment. And it doesn't have to be false hope. I'm not talking about false hope. There's plenty to hope for in modern medicine. We just have to make sure we give it in the appropriate form and the appropriate dose.
So often I hear people come into me and say, you know, the doctor just said there's no hope. And you can see their faces drained. They are so unhappy. Why do you think inadvertently medical professionals take away people's hope?
Because I think sometimes this concept of being honest, being truthful, giving the patients all the information somehow takes on this construct that in medicine we look at statistics and we look at outcomes. But a patient is not a statistic. If you tell someone that they're going to have 6 months to live, I honestly believe their whole body sets its frame to that time period. And you don't know. The truth is that we never know how long someone has to live. And I've seen people with terrible diagnoses of pancreatic cancer. You know, that's one of the areas that I'm actually first to give a diagnosis in. And I have seen patients being told they have 2 months to live, 6 months to live, and they've lived 2 years or 3 years. You just don't know. Of course, sometimes they do live only 2 or 3 months. But because we don't know, why do we assume the worst? Why not instead assume the best and then try and modify what we're hoping for as we go forward?